diverse sectors of the federal government, way far removed from health and human services, are considering the outcomes of the way they deliver service to this country, be it improving upon transportation, improving housing, et cetera, clean air. All of those things are going to add up to better health outcomes.
When you think about health, what comes to mind? Is it your diet and exercise? Or how about your mental health? Or maybe it's access to preventive medicine and a clean environment. Our health is multidimensional. Thus, it's extremely important that our federal health agencies can help elevate every aspect of our well-being. For over 4 decades now, the Department of Health and Human Services, or HHS, has been setting ambitious and measurable objectives to improve the health and well-being of all people in the U.S. through an initiative called Healthy People. At the beginning of each decade since 1980, HHS's Office of Disease Prevention and Health Promotion, ODPHP, has set these goals that range from getting people properly vaccinated to improving cancer prevention. In its 5th iteration now, Healthy People 2030 has 358 objectives and prioritizes health equity and literacy. Amid the disparities and barriers we saw during the COVID-19 pandemic, now is the ideal moment to talk about health promotion and equity. So today on Empathy FX, the Forest Marsh Media podcast that explores the human side of government, let's learn about how Healthy People 2030 is guiding us to be a healthier, more equitable nation. I'm Melissa Harris, and with us today is ODPHP's director, Rear Admiral Paul Reed. He's spent his career in many places across the healthcare space in a way that deeply informs his work today. I'm so excited about this conversation, so let's get into it. Dr. Reed, welcome to Empathy Effect. It's really wonderful to have you here.
Oh, thank you, Melissa. I really appreciate the invitation. I look forward to today's conversation. Thanks.
You have such a fascinating career, especially, looking over the arc of where you've been. I understand you wanted to start off your career in pediatrics, but dabbled in Navy medicine and humanitarian aid. And these roles, especially the military and humanitarian aid ones, are quite different from where you are now advising on policies and programs and disease prevention and health promotion. So what in your career and experiences led you from your former roles to where you are now?
Yeah, my career has been an accidental one, frankly. But you did more than allude to what's at the core of me professionally and personally in many respects. And that's the pediatrician that I am. And I don't see actually the start of my career in direct clinical care as a pediatrician that far removed from policy work in the portfolio that I'm responsible for now at the Office of Disease Prevention and Health Promotion. Because there's a common aspect to both of them that's very deep rooted. And that's in how we maintain our health. That's in the prevention of disease and promoting health for ourselves and our loved ones. We just happen to do it out of my office at the national scale in terms of policy development and guidance development. But at its root, at its core, it very much is similar to the preventive medicine aspects of direct clinical care in pediatrics, I guess I could say. Now, how I got here, the path I took is very convoluted, as you suggested. During my Navy career as a pediatrician, a healthcare administrator later on, I also, typical of uniformed service, adopted a lot of other duties as assigned, as we like to say, which led to me developing a skill set that in some respects was attractive to the U.S. Public Health Service in my mid-career. They were looking for officers with a background in deployed medicine and humanitarian assistance that I had some experience with during my Navy years. And for that reason, I was recruited into the PHS. And that was a sizable amount of the work that I did over the ensuing years after transferring service back in 2008. And through that work, which spanned humanitarian assistance overseas, disaster response domestically, and global health work in even broader terms, I think that's where I learned my public health perspective. I've actually never been formally trained in public health, which a lot of people find very ironic given the position I hold today and the fact that I'm an admiral in the U.S. Public Health Service. But that experience I had, those experiences I had were far and wide and cross-cutting many aspects of public health. And I employ that experience today in everything we talk about and do in the Office of Disease Prevention and Health Promotion. Seeing what leads to health or ill health in parts of the world far removed from the experience we have in the United States here, you learn a lot about what the essence of public health is all about.
In your experience, you've seen all sorts of challenges with health, and ODPHP also covers a lot of different health focuses from diet and exercise and beyond, and has different functions like data collection and policy guidance. So it may be a good moment here just to get to know your office a bit. What are some of the top health areas that your office works on, and how do you implement guidance accordingly?
The work that we do is derived from the National Consumer Health Information and Health Promotion Act, dating back to 1976, along with other legislation related to the Public Health Service Act and follow-on legislation. But ultimately, the legislation that defines our office has to do with policy development, oversight, and coordination of HHS activities in disease prevention, health promotion, identification of unmet needs related to health information and disease prevention, and development of resources to meet those needs, as well as the dissemination of health information. So that's the kind of generic statutory language. But more practically, the way we translate that is in four major ways. One is setting national goals and objectives, and we largely do that through our hallmark program, Healthy People. But we also do it more recently through this whole of government initiative, the Equitable Long-Term Recovery and Resilience Plan, which we have responsibility for stewardship over. The second big bucket is in establishing guidance for Americans directly to health professional organizations as well as to the lay public. I consider this our translational work, where we interpret the up-to-date science and provide guidance based on that science in the form of the Dietary Guidelines for Americans, which, by the way, we do in partnership with colleagues at the USDA, Department of Agriculture, and then as well the Physical Activity Guidelines. Thirdly, our initiatives around the uptake of preventive health services. We have a longstanding web-based platform called My Health Finder, which helps individuals identify what their preventive health service needs are and how to go about communicating and interacting with their healthcare providers around those preventive health service needs. And then we also have a portfolio of health literacy, which helps to kind of further the dialogue around how people learn and understand about their health, and how organizations, frankly, are able to translate health-related information to their constituents, be it their employees or their customers, et cetera. And then lastly, we encourage the adoption of healthy lifestyles, healthy behaviors, and the systems around opportunities for healthy behaviors. And we do that through various communication strategies. And then we're responsible for administrating the President's Council on Sports, Fitness, and Nutrition, which has long since existed to reach the American public through alternative ways and convey the messages that we might translate from the science into guidance through their forum.
Well, we could sit here all day chatting about all of these different, areas of work that your office does. It's really impressive. But I want to go back to that first bucket you're talking about with Healthy People.
Mm-hmm.
The program has been around for decades, and I think it's in its fifth decade now.
That's correct, yeah.
With Healthy People 2030, you set objectives every decade, but this time around, there's a big emphasis on health equity, social determinants of health, and health literacy. So why these three in this moment, especially amid all of the over 300 objectives that have been set for the decade? What other ways have you seen Healthy People evolve in this decade's iteration compared to the previous one?
If you look back over the 40 years leading up to Healthy People 2030, dating back to 1980, there's been a continuous evolution in the focus of Healthy People, from a much greater focus on health outcomes, disease outcomes, if you will, to what we see today, as you've more than alluded to, a very heavy weighting on those, what many would refer to as upstream factors, the social determinants of health, the things that lead to health outcomes, be they negative or positive. That trajectory, that evolution has been ongoing for 40 plus years now. So it isn't that Healthy People 2030 has just kicked off the idea that we ought to be thinking much more intensely about social determinants and health literacy and health equity. It's more that the balance of objectives that exist within healthy people and the cross-cutting emphasis on equity in all objectives is now at the fore, but it's always been evolving towards that for 40 plus years. I think in this, it's particularly prescient that Healthy People 2030, which really was developed in the previous 5 to 8 years, has an emphasis in this way because of what we now are experiencing and probably realizing more than we ever have as a result of having come through the pandemic, that health equity is imperative, that inequities in general have profound influences on our social circumstances, which subsequently determine our level of resilience and therefore our level of risk to things like emerging infectious diseases. We see the emphasis probably more so in healthy people today because we have this common heightened awareness to how important these issues are. I will say in answer to the question, what else have we noticed about the evolution of healthy people, particularly in its current form, Healthy People 2030, is actually the contraction in the number of objectives. We have 358 measurable objectives at this point, or just thereabouts, which is a far cry from the more than 1,000 that existed in the last iteration. Mm-hmm. And that was by design. That was intentional because it helps focus. It helps hone in on the most significant high priority areas that we need to be paying attention to.
I know that ODPHP has a Healthy People Advisory Committee that has helped your office pave the direction for this decade's objectives, including that contraction. So since this group came and set up the goals, even before you started at ODPHP, I'd like to see from, the seat you're in, how did the committee decide on these objectives, especially since they focus on influenza vaccination rates, improving prenatal care, drug abuse, substance abuse. It's really far-reaching. How did they manage to cover so much ground while also reducing the number?
Yeah. To say it was a heavy lift is to put it mildly. It was largely driven by the fact that the selection criteria that were established became much more stringent, as did the requirements around the data for various objectives in order for them to be incorporated into Healthy People 2030. That became much more rigorous than in previous iterations, and appropriately so, because it allows us to have objectives that are much richer in one, content and focus around high priority areas, but two, in terms of the value of the data that we can render from those objectives and observe over time. And then there was the aspect of ensuring health equity was pervasive in the objectives of Healthy People 2030. That was a key consideration in determining which objectives should be there and which should not, as we work to refine them and hone them down. Another characteristic of the quality of data is ensuring that baseline data for objectives, measurable objectives, existed that was rich and current. So much so that core objectives included in Healthy People 2030 include baseline data from no earlier than 2015, as an example of just one criteria that helped refine those objectives overall.
Can you break down how you track progress across these Healthy People objectives? How do you tap into different data sources and work with different partners to get accurate results, especially when it comes to meeting underserved communities that perhaps haven't been represented in data, and in getting to the health equity piece?
Yeah, first I have to recognize, in answer to that question, the National Center for Health Statistics, CDC, which is our key partner in managing the data. Without them, this wouldn't happen. How do we track the progress? Well, one, it's about ensuring focus, and Healthy People 2030 organizes our focus on objectives from very high level overarching health and well-being measures, which you can think of as, the more macroscopic issues of mortality rate, et cetera, to what we refer to as the leading health indicators, which are a subset of the overall number of core measurable objectives we have, 23 of which we consider leading health indicators. And those are particularly of high priority focus. And they are of a variety themselves, including many aspects of social determinants are incorporated into the leading health indicators, but also high priority health outcomes that we need to maintain focus on. So it's ensuring that focus that's kind of the starting point, if you will, for our ability to track progress.
A lot of what we have in this country, as many have said, is a disease care system. So it's hard to measure the success of prevention or, how people are doing. And I want to go back to the COVID piece that you mentioned there. Obviously, Healthy People came up with its themes of health equity before COVID, but then the pandemic really just brought to the forefront challenges with health equity and the disparities that were there, and in many ways exacerbated them. So do you think that the pandemic has shifted some of the progress with the objectives of Healthy People?
What has always been true in terms of inequity has just been amplified, accentuated, laid bare by the pandemic. We no longer can avoid, one, being aware of it, and two, talking about it. So though Healthy People 2030 had incorporated health equity as a predominant issue that has to be considered in all aspects of measuring progress towards advancing health, we now have the added emphasis that I think all of us in some way, all of us as individuals, citizens of this country, citizens of this world, have a heightened awareness to implications of inequity, implications of resilience, our inherent personal resilience and that of our families and communities. And I don't think we should take that lightly. I certainly don't, in considering how our office needs to move forward and how our messages need to evolve. I speak often about the importance of this enhanced awareness that we all have as a result of what we've experienced due to COVID. And I think in a way we need to take advantage of it. If there's a silver lining to COVID, it may be in that we do have this added awareness. We do have a sense of our own resilience or lack thereof. We do have a sense of the importance of being healthy and being well and its implications on our vulnerability. And when I say well, I mean well in all aspects, all facets of that, not just in our physical health or our mental health, but in our social and economic well-being and in all the other characteristics that might define it. But another thing practically to consider in answer to your question is how the access to preventive health services has evolved. We know prior to the pandemic, nationwide, we were not doing very well at all in terms of adults accessing preventive health services. We have done better with children accessing preventive health services, but in 2018, it was roughly 7% of adult population that we could say adequately were meeting recommended preventive health services.
Wow.
And that worsened as a result of the pandemic. It worsened particularly early on in 2020 as a result of limitations to access to healthcare in general, that folks were not taking advantage of what they may otherwise have taken advantage of in the way of breast cancer screenings or colorectal screenings, for instance, nearly to the degree that they even were in 2018 and 19, which was insufficient, as I mentioned. And we haven't seen that back to baseline yet, much less improving from our baseline, from pre-pandemic levels, which is something we very much have to focus on. And it is something that we are talking about out of our office, just as another slightly more concrete answer to your question, I think.
Yeah. I'm curious, what are some of the reasons why preventative services have been so hard to reach for adults? Is it awareness? Is it barriers to access? What are the driving factors?
They are many, and they're variable. It's not the same for everyone, the reasons for lack of accessing the preventive health services. I believe much of it has to do with health literacy. We have a very, very diverse population in the United States, and being able to communicate well, accurately, have reach to various communities, and speak to those various communities in ways that they can understand and act is a challenge, and one that we definitely need to exert some effort around. But there's also this issue of those social determinants that greatly affect individuals, families, and communities in their ability to access preventive health services. Very practically, just being able to go from point A to point B for some folks is a challenge.
Getting back to the data piece a bit, for the healthy people objectives that aren't improving, how do you use data to help map out plans to make progress and to, maybe increase health literacy or better improve access? I know that, for instance, we're behind on influenza vaccinations for people under the age of 65. So how do we take information like this to better strategize things like vaccination campaigns or to, get people in for preventative services?
Well, that largely takes place at the very local level. That's where interventions in public health, in communications with communities really is most profound, most impactful. Just yesterday, we were talking with a representative from a local health department, one of our Healthy People champions, actually, who was discussing their use of the leading health indicators and certain objectives related to tobacco use as one of their priority focus areas as a result of understanding baseline data in their communities in terms of the prevalence of tobacco use and seeing it as probably one of the greatest modifiable risk factors that they could attend to. And she very eloquently demonstrated data evolving over time based in those objectives of healthy people that related to tobacco use and the favorable trends in that data as a result of the programs, the interventions that they were employing to get the message out, to reach community members where tobacco use was most prevalent, to ensure connections to resources to reduce tobacco use were made available. It was nice to hear. It was a very practical way of understanding how this data that we build out through Healthy People can be readily available and very relevant to the particular needs of discrete communities. In this case, it was at the level of a rather large, I think it was roughly 2 million person population in a county that she was speaking to. But nonetheless, it was at a much more discrete level of community than we might be able to engage here at the national level. But having said that, to answer your question from a national perspective, or at least from our perspective at ODPHP, the data that we see and the data trends we see in Healthy People very much inform our programs.
With Healthy People 2030, I know there are objectives all over the place, but I was wondering if you could share some of the most challenging ones to meet the goals of. And are any of these indicators of some of the more macro level issues in our healthcare and public health systems?
Yeah, that's a great question, but also a difficult one, because the most challenging issues at the national level may not necessarily be true as the most challenging issues at a smaller level of community in different parts of the country. So we have to respect that the most pressing issues from a public health standpoint are highly variable, zip code to zip code all around this nation. But that being said, at a national level, there are profound issues that we contend with. And I think if I was pressed to answer your question, I would say the most challenging objectives are around the more macroscopic measures of prevalence of diet-related chronic disease and chronic disease influenced by levels of physical activity. We know that if you look at it from a burden of disease standpoint on the healthcare system, by far and away, the greatest concerns we face in numbers, sheer numbers, in terms of premature mortality and morbidity relate to those issues. So we do pay a significant amount of attention at the national level in a very macroscopic way to those sorts of things. And they relate to much of the issues of the social that we talk about in the social determinants. The number of modifiable risk factors, as we sometimes refer to them, are implicated in these considerations, like obesity, like coronary vascular disease, et cetera. But influencing those modifiable risk factors are the conditions within which people live. And we have to attend to those social determinants. Otherwise, we will never be able to fully tackle the most challenging objectives that as you asked about.
Do you think that some of the work you've done, especially in humanitarian aid, helps drive your focus on social determinants of health and health equity? I know you've done work in all sorts of areas of the world where people have really suffered from disparate conditions.
Mm-hmm.
Does this inform the lens in which you work out of?
Oh, by all means. I'm incredibly biased as a result of all that experience and what I've bared witness to. And that's true of, very depressed, financially unstable environments in other parts of the world. It's true of environments around the world where there's conflict, mass migration, but it's equally true for settings here in the United States that may be impacted by disaster, for instance, where those social conditions, those negative social conditions are amplified or exacerbated. But I've also come to learn that it's true of everyday life here in the United States as well, all around this country. And I've learned to understand the social conditions within which we live, whether they're secondary to disaster or they're just the way they are because that's the way they are, for the inequities that exist, for the economic conditions that exist, for the accessibility to meaningful education and opportunities to work. Yes, I would say that I'm biased to think about our work in that light. And I believe the more we move into those conditions, those situations, those sectors of our lives that have less to do with healthcare, believe it or not, and more to do with our everyday experience, and improve upon those conditions, the more we're going to improve upon the health outcomes in this country.
I know you've chatted a little bit about how at the state and local level, those are really some of the key partners there. And you have advisory committees at ODPHP that also help you achieve your office's responsibilities. But how do you lean on other external groups, maybe other agencies? I know you mentioned CDC, health professionals, industry partners, other people we maybe haven't touched upon yet to achieve your mission.
Everybody, every sector, every corner of government and civil society has a role to play in helping to advance the circumstances that people are faced with in order to be healthy. At a federal level, we have increasingly diverse partners with our office, including corners of housing and urban development and the Department of Transportation. I mentioned we have a prominent partner in the U.S. Department of Agriculture in our work in developing the Dietary Guidelines for Americans. And we're expanding that. Every day, we're talking to more and more non-traditional partners in advancing health. I would argue some of our most forward-leaning thinkers in federal government right now on improving resilience in communities around the country are those in the Department of Commerce and the Department of Transportation as examples. But there are many examples, frankly. So we are reaching into those corners of federal government and establishing much more effective and deliberate partnerships in that way. But if we look outside of federal government, it's far-reaching. We actually have two champion programs out of our office, the Healthy People 2030 Champion Program and the National Youth Sports Strategy Champion Program, both of which are designed to welcome partners from all corners, including private industry, including nonprofits, philanthropy, et cetera, local governments, you name it, academia, that work towards achieving, in the case of Healthy People 2030 Champions, those overarching goals and the vision of healthy people. Mm-hmm. In the case of the National Youth Sports Strategy, it's those organizations that subscribe to and help advance the tenets of the National Youth Sports Strategy, ensuring access to sports and physical activity for all children. Those two champion programs are pretty powerful. One, we scrutinize very seriously who we consider worthy of being recognized as a champion in either of those programs, and we amplify their messages. We spend a lot of time lifting them up and sharing the successes that they have and the approaches that they take in order to see those goals and those visions realized. And we welcome, like I said, very diverse sectors into those programs.
I know we're just a few years into the decade and we've covered a lot of ground here, But where would you say the overall state of our country's health is in, given the context of healthy people and the objectives you set? Where do you see our trajectory going over the next few years before 2030? And what key actions do we really need to take to get there?
Well, now you put me on the spot. Regrettably, the truth about the health of this nation is dire by every measure almost. And that's no exaggeration. Unfortunately, we don't spend a lot of time talking about just how dire it really is, but it's not good. The trajectory on prevalence of obesity, for instance, the trajectory on suicidality, and substance use disorder and overdoses is scary. And we have a lot to do to bend those curves, to improve upon those rates. But it is going to take radical change. I think you mentioned it very early on in this conversation that we have a disease-centric healthcare system. And we do. We invest a lot in disease care. And we do it very well when it's readily accessed. But what we don't do is invest in health promotion, in ensuring people are healthy and they avoid becoming diseased by looking to those environments where people exist, live every day, and improving upon those environments to maximize opportunity for healthy living. We've said that a handful of times, if not more today, but it's probably a good point to end on, because if we are going to see improvements in that overall picture, which today is rather dire, then it's going to take that level of effort, that profound investment in the way in which, and the how in which we live to ensure opportunity for health.
So, amid this dire situation, how can we move forward to enact this needed change?
Well, I should say on an optimistic note, one, we are all more conscious of the sets of issues that we've been talking about here today, which is great because it starts with awareness, right? With that awareness, we can drive change. That sounds a bit cliche, I know, but it's true. It's very true. Policy doesn't happen in the absence of consciousness or awareness, but we have that today, and we have dialogue that's bipartisan around improving the nutritional status of this country. As one rather profound example, we didn't have that even 2 years ago. And I think that's playing out in other ways as well. I mentioned how diverse sectors of the federal government, way far removed from health and human services, are considering the outcomes of the way they deliver service to this country, be it improving upon transportation, improving housing, et cetera, clean air. All of those things are going to add up to better health outcomes, as I mentioned. And I am optimistic. I do see all of that heightened awareness and that willingness to change and refocus our attention to where it needs to be. So I think maybe that's a good note to end on for our conversation today.
I also think that's a really great note to end on. Dr. Reed, it's been so wonderful chatting with you. I'm really looking forward to seeing where the different campaigns your office takes next, following the data with healthy people, and best of luck in moving the needle. If anyone had to help us get there, you definitely make me feel confident about it.
Oh, well, thank you for that, Melissa. I really appreciate talking to you. You've been terrific. Thanks.
Like Dr. Reed said, this is a profound moment to enact the policies that will help guide our country to further progress in health and well-being. You can learn more about Healthy People's 2030 objectives at health.gov/healthypeople. Healthy People tracks a lot of public health challenges, and one that really has been difficult to overcome in recent years is the opioid crisis. Next month's episode will dive into the crisis, and we'll learn about how a major study at the National Institutes of Health is looking for effective ways to prevent and treat opioid use disorder. I hope you'll tune in next month, and in the meantime, don't forget to follow, subscribe, and share the show with others. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Forrest Marsh, or becoming a part of our community, check out our show notes for more information.